Hey friends, welcome to the PTA Plus podcast. Today's guest is Jeremy Foster. He is a physical therapist assistant from Mississippi. Jeremy is doing all kinds of things to fill in that PTA Plus blank. He's a PT PAC trustee. He is a PTA council representative for Mississippi, as well as a tennis coach and a father, and all kinds of things that he's got going on. Well, Jeremy has a really cool story that you're not going to want to miss. He asked a question a few years back at CSM, and he wasn't super satisfied with his answer. And so he took it all the way to the World Confederation of Physical Therapy Congress in Dubai and started asking some questions to the international stage. What does it look like for physical therapist assistants on the international stage? Well, you're going to hear a little bit more about that if you listen to today's conversation. And he has a lot of grassroots efforts going on to see if we can get more PTAs out there internationally. We want to see if we can make some changes. So I can't wait for you to hear my conversation with Jeremy. He's got a lot going on. I learned a lot. I'm sure you're going to learn a lot. I hope you enjoy the show. Thank you. All right. Hi, Jeremy. How are you?
Oh, man, I'm doing great.
Good. Welcome to the PTA Plus podcast.
Thank you. Thank you for having me.
Yes. And thank you for saying yes and for supporting the podcast. I know that I'm a newbie, so it's probably very easy for people to say no. And well, you didn't.
I'm excited. I think it's a great thing. And I think we need more of these and get to talking about physical therapy and get it put out there more and more about what we do and what we're experiencing. And so thank you for doing this.
Yes, there's a lot that we can talk about. So I already know just from you and I's conversations before we even hit record that we're going to have you back because you have a lot of knowledge. And today's conversation is going to be so cool that I'm not sure we're going to get to touch base on everything. So I'll probably have you come back on.
I'll try to stay on topic.
Oh, well, if not, then that's okay too. Because like I said, we have a lot of things that we can talk about. So just to let our audience know who you are, you're a physical therapist assistant and you're from Mississippi. So what else do you do? What are you doing right now?
Well, in 2020, I purchased, I call it a mini farm. It's not, it's 8 acres. It's got some wooded areas and pasture land. We raised some chickens, not a bunch of them, but we like the idea of raising our own eggs. I'm a tennis coach. I coach for a private school here, and I do that 3 months out of the year. I give some tennis lessons here and there, and I'm also the PT. I'm a PT PAC trustee, so there's 8 of those for the PT PAC. And then, I'm also the PT Council rep for Mississippi.
That's awesome. What practice setting do you work in?
So I work in a critical access hospital. There's around 1,300 of those across the country, for those that don't know. It's basically a 25-bed facility that can be rehab, which is your Part A days up to 20 days, or it can be an acute care bed. So inside our hospital, we have 25 beds. We have an ER, and then we have a clinic, and then we have a 10-bed inpatient geriatric psych unit, and then we're connected to a 60-bed nursing home. So a little bit of variety.
Yeah. Now, do you work in like multiple departments, or are you kind of?
I work in acute, swing bed, and geriatric psych.
Okay.
And we have outpatient therapists that treat outpatients, and then we have a full staff in the 60-bed nursing home of PT, OT, and speech. So we're well. We have a great rehab team there. I treat it as I treat our patients like it's an inpatient rehab. So we're doing anywhere from 3 hours to 5 hours. It depends.
Wow.
If they need a lot of therapy, it's the place to go.
That's great. And I know that you have a great team. I've seen you talk a lot about them and have just wonderful things to say about your team.
Good people. They all got hearts of gold, and they really they really like to see success, and they take things personal. They do things extra for the patients all the time, and like I said, I'm very fortunate to work where I work.
Absolutely. That makes work fun when
Yeah.
you can enjoy going in there and you feel like you've done something good and you sleep good at night. And
Yeah, definitely.
yeah, that's great. I'm a big chicken fan too. So we can swap chicken stories later. So, I don't have any egg chickens right now, but
I'm very protective of the chickens right now. I want to do
I
free
know,
range.
right?
I'm so worried about coyotes and different
Hmm.
animals hurting them and things like that.
Hmm.
And so, but I will eventually be free range chickens, but not yet.
What sounds like you in Mississippi and me in Ohio, we have very similar things going on here. We were talking earlier about how rural we both are and how internet is not really something that it's not our strong suit, internet in these rural communities and stuff.
Correct.
So we're just going to apologize in advance to the audience that we do the best that we can. So,
That's right.
yeah. So as you know, the PTA podcast, it was kind of brought about because I like to highlight all the really cool things that PTs do alongside of being a physical therapist assistant. So we like to kind of fill in the blank. And so every PTA can finish the sentence. I'm a PTA plus I am a, so on and so forth. So you've already told us a little bit about you with like your background as a tennis coach and PT PAC trustee and PTA council representative. Is there anything else that you would fill in the blank with?
Wow. I'm a father to two daughters. They keep me busy. Basically trying to take care of the farm here. Trying to do some different things, and for in Mississippi, grass grows every 5 days. You're on a mower every 5 days. So it was just the grass grows, and if you don't cut it in 5 days, you've got hay that's about 3 feet tall. So that's an interesting thing. I spend a lot of time on a lawnmower with my headphones on and jam music and try to listen to some podcasts here and there, and that kind of thing. So that's what I do.
Awesome. That's great. There's something you forgot though. You're a world traveler.
Okay. Yes, I do like to try to travel when I can. Yeah. So and also all things physical therapy related. I read a lot of journals. I won't say I read all the articles, but I do look for the conclusions.
Yes.
So that's one thing I do.
Yeah, absolutely. You start to learn like where you want to pick the information and really kind of focus on that. And sometimes that helps me decide like, is this something I want to finish reading, or is it something that's very pertinent to what I do? Is it something that's going to help me right away? Because if not, then I might push that to the side and read it another day, or it might come up a little bit further on my reading list. I like to read as well, but go ahead.
There's so much research in physical therapy that if you read all the research that was out there, you wouldn't do anything else. There's nothing else
Exactly.
you could. So you have to kind of pick and choose what's like. For me, it's kind of practice setting. I don't work with kids. That's the one setting that I haven't worked in my career. So when there's pediatric studies and things like that, I kind of skip through stuff of that. I just because it doesn't work, but if there's something really interesting that maybe affects my kids or something, then I might kind of peruse through it. So I do a lot of reading.
Yep, absolutely. I actually have done a little bit of pediatrics. I don't know if I was any good at it, and I think I may have been drug into it kicking and screaming a little bit. I enjoyed it, but I feel like I was never like an expert at it. It wasn't like something that really came natural to me at first, but I think I did okay.
There you go.
But
I know you did. I respect the pediatric therapist. I just realized early on that I would have a tough time at 50 getting up and down off the floor, and I thought, well, that's not going to be the best practice for me. But that's one area that I haven't worked in.
yeah, you can get a little dirty in that part, but I didn't do it full time, so I don't know that I can really claim it as my own, but I spent just a little bit of time in it. So yeah. So the reason why you and I decided to talk today was because you just returned from a trip. You went to Dubai.
Yes.
I mean, how does so you went to the World Confederation of Physical Therapy Congress? Am I saying it right?
Yes. We'll
Yeah.
refer to it as WCPT from now on.
Perfect. So how does Jeremy Foster from Mississippi in the United States of America end up in Dubai?
That's
Tell us
a
that story.
great question. So we'll go back to 2018. We'll start way back in 2018.
Okay.
So in
Rewind.
2018, I attend a CSM, and they had some booths there that were for medical missions, and they were looking for physical therapists to volunteer to go to different countries and provide physical therapy services. So, of course, at this point in time in my life, I'm looking at how, volunteering to go places and do things. And so I went and visited each one of them. And each one of them, I was basically told that because those countries don't recognize what a physical therapist assistant is, there's no licensure or regulation, I could not practice physical therapy, even with physical therapists as
Interesting.
Mm-hmm. And so that really kind of got my gears going, and I just kind of thought, man, this just isn't right, Mm-hmm. And so I started thinking about what could I do, to change that, to change the ability for us to go different, to work in different countries. Mm-hmm. So in 2019, I signed up to volunteer as a volunteer for the WCPT in Geneva, Switzerland.
Okay.
And they chose me. I was
Yay! Of course they did.
kind of fun. And there's a lot of students that volunteer and things like that. Mm-hmm. And I just had a blast. And the only requirement was that you had to be fluent in the English language. Woo!
Oh my goodness! I could have applied.
You could have gone. See. So anyway, I got there, and I got to actually meet the president of the International Red Cross, and I had a really good, deep discussion about the fact that I knew other PTAs that would like to do this, and she kind of alerted me to something that they do that I didn't know, but they actually hire PTs to go to these countries and help set up physical therapy practices. So they actually show them how a practice would run. How the billing would go, how you would take care of files and things like that. They do all of that. And so a PTA wouldn't necessarily be somebody that could do the Red Cross thing.
Yeah. Mm-hmm.
So, but what that did was it really got me thinking about how can PTAs be recognized on the international stage versus just in the United States. So that's kind of how this all kind of got started. So after I did that, I said, well, I think what I need to do, and also there's a couple of people that I met at these conferences that said there has to be a way to separate the PTA from all of the other language that are being used in these other countries. Because they have what they call PT assistants. They have PT aides, they have PT technicians, and this one I really like. They have PT help. That's WCPT puts us all in one lump category under support personnel. It's just a lump. So there's a problem there. So I decided right then and there that I would do my best to get to. It was going to be Tokyo, Japan. No, it was Dubai. I'm sorry. It was going to be Dubai, and then what happened was Dubai got canceled because of COVID. So I didn't end up going. And they have these conferences every 2 years. The congresses come. Okay. And so the Dubai thing, it didn't happen. And so I had time to be thinking about what do I need to do. And one of the things I wanted to do was I thought, well, you had quite a bit of time between 2019. So I had 4 years. to kind of think this. And so I thought to myself, what I should do is I will try to do a presentation. What they have is they have what they call focused symposiums.
Okay.
And those are like what you go to at CSM. They're like 2-hour programs on a topic. Well, I tried to do that, but they really wanted a few more people to go. And I actually had a few people that had talked to me about interest in going, but it was kind of up in the air with COVID and everything else like that. So they have another way of presenting. It's called an indaba, which is, it's South African for a meeting of the minds, a meeting of where it's like a discussion. And so I proposed an indaba session on PTAs, and they accepted that. They accepted that I would do that. So what it is, it's about 15-20 minutes of talk about the PTAs, and then you answer questions.
Okay.
So anyway, and so I did that, and I didn't have the I'm trying to think of the right words. There weren't as many people as I would have liked to have been there, and I don't know, the way they presented it was just PTAs. It didn't have anything. So I kind of think that a lot of people thought, well, that's for PTAs,
It's the only,
I didn't have turnout as I'd like, but I did have a few people there that asked some really good questions. And I found out from one fellow that England actually has about 9,000 physical therapy assistants. They're not regulated. There's no testing, and there's no schooling. And it's on the job training. So I thought that was interesting.
Yeah.
So big difference between the, what they're saying, support personnel versus the PTA. So I presented there. I had really good discussions with some really important people there. The vice president, her name is, I'll mess up her name, but she's from Taiwan. And I met her in 2019, and because she was the president of the Taiwan Physical Therapy Association. And then I met her again at this one, and we had a good discussion. And she's now the vice president of WCPT. So,
all right.
I think that's going to help.
Get some traction there.
Definitely, because it's about relationships. It really is.
Yeah.
Within the APTA, I've seen so many great relationships that help the whole community. It's been amazing over the last 10 years how one person making a connection with one person, they can bring people together and make big changes. So that's kind of my idea. That's my hopes.
Yeah. So what I'm hearing you say is there was a moment that you discovered a piece of information that didn't necessarily sit well with you because there was something that you wanted to do and you had the desire to do, but you were almost being held back because of that PTA, the licensure differences and what's available in other countries and whatnot. But then you kind of were set on a mission. Like it was almost like something was struck with you and you were like, okay, I'm going to take this as my own personal mission and I'm going to fix this somehow, some way.
Exactly. That's exactly how it was. It's like a light bulb went off inside my head and said, there's something wrong with this. When somebody wants to volunteer, who's been doing this is not something like this isn't somebody who just got out of school to volunteer. This is somebody who's been active. And they've really honed some really good skills that they feel like they could offer the world, and they're being held back and told not to. It's not like the need's going away. There's a need out there. It's not going away. So the big thought is how does that happen? How do we make that happen? And there's some big challenges. And so the first thing that I recognized coming out of Dubai was the definition. So WCPT, we have to figure out a way to get the PTA elevated and separated from support personnel.
Yeah.
Our support personnel, we support the mission of physical therapy for sure, but the extenders of choice. We are to me, the only extender of physical therapy services. And so what I did recently was I picked out about 20 different people that I've met over the years, PTAs, and I sent them out an email. And I'm going to be sending out some more of these. But I sent out an email stating that I was asking for help to develop a definition of the PTA that would encompass education, licensure exam, regulation, and continuing education. All of those things. Because there's not a definition that exists that I'm aware of that covers all of those criteria. So it doesn't cover all that. So a definition in the United States may be, a generic type definition of the PTA, but for an international definition, it has to be something more like a paragraph, and it may cover what's in our education. It might be something, because a lot of countries don't have associate degree level training.
Yeah, nothing as formal as what we have.
Yes, they do have technical schools that a lot of our PTA programs are in technical schools or technical programs. I know that our PTA program was in the automotive, so we had automotive, nursing, surgical tech, physical therapist assisting, and welding. There was welding.
Yeah,
So,
I can see it. Sometimes we kind of act like an automotive technician in some ways, right?
Exactly. Somebody, a master mechanic diagnosed the problem and the technician fixed the problem.
Yeah, I can see it.
I always think of us as extra hands. And when I was talking to some of the international PTs, I talked to a lot of international PTs, and I said, what could you do if your day was spent, if you were able to evaluate folks and figure out what was their disorder or what could we do, and you were able to set up plans, and instead of you actually having to run the plans, if someone could run those plans for you and have the same results, but you moving on to the next person. And in national health systems, Belgium, Germany, the United Kingdom, they have these large national health systems that sometimes the PT may have 20 evals that day.
Wow.
But they've got 10 treatments.
Yeah.
So sometimes you don't have your evaluation till 2 weeks, 3 weeks out. And we know that delay can cause some really harm. The sooner we can get onto something, the better we can start resolving that issue.
Yeah, absolutely.
A couple of facts that I'll just throw out real quick. This comes from so there's a WCPT annual report. And as we talked about earlier, if you are a member of the APTA, you are a member of a member organization. So therefore, you're a member of WCPT, which I don't think anybody really thinks about much.
Congratulations to everyone learning about this at the same time. Yeah, you're part of something else. You didn't even know it.
I think that's important to understand. And the United States, we're not the largest organization. That's another thing that's kind of interesting.
Okay.
Japan has more members of their organizations. And I believe I might misquote, but I think there's 127 member organizations. I emailed each one of them. I emailed each one, and I asked them all these questions about, do they have programs for PTAs? Do they have PTAs? And I got about 80 of them back, which was really cool.
Wow.
And they don't utilize assistants in that capacity. There's no formal education. there's no licensure exam, and there's no regulation of those people that they call physical therapy assistants. So I think that's important. But according to the 2022 WCPT report that they put out, it stated that, well, number one, our census is 8 billion. So the world census is 8 billion people. And that happened in November of last year somewhere. The clicker went around to 8 billion. That's a lot of people.
There's a lot of humans. Yep.
Yeah. Now, here's one that I wouldn't have known, but according to WCPT, there's 1.9 million physical therapists in the world. 1.9 million. So the WCPT says that approximately 2 billion people will need physical therapy services. I don't know how they came up with that number. There's no data to provide that. I honestly believe that number is it's not enough. I think there's, because of
probably low.
Yes, that's what I'm thinking. Out of 8 billion, 2 billion will need physical therapy services. I think that the things that we're coming out with, the better treatments for Parkinson's and MS, so the neurological condition, I just think there's more things that we could be doing with more people. So 2 billion sounds like a small number. That's my opinion. But 2 billion, even with 1.9 million therapists, that's not enough hands.
The math still doesn't work out, even if we're shooting on the low end, right?
It doesn't. So they have geographical areas, and they show that the European Union, the European area, or the European region, has about 11.4 therapists per 10,000 people.
Wow.
Yeah. So that's not very many, So, but again, and I don't remember the U.S. It seemed like it was 8.4 or something like that per 10,000, which I'm not. Don't quote me on those numbers. I don't have I should have had that paper with me, but I have the report, but I don't have it with me. But anyways, so what I'm saying is that we have around 90 to 100,000, depending on how you read the Bureau of Labor and Statistics reports, because sometimes the way that they document it is that they're considering aides and techs in with the physical therapist assistant, which that happens, but it shouldn't happen, because I think we've established there is a big difference between technician and PTA.
Yeah, especially here in the U.S. Yeah.
So I use some of those numbers to kind of help them to understand the idea that the PTA could be used in certain economies across the world. I don't think that the PTA can be used in every country, and the reason I say that is because financially, there's no money for it. So in other words, the government doesn't provide the money for physical therapy in a lot of nations. So the Philippines is a perfect example. The Philippines they don't have coverage for physical therapy services. That's out of pocket, and they can barely pay the PTs enough to cover their costs. So a PT assistant, and also their educational programs, they don't have 2-3 programs. But a thought hit me that in the United States, we accept PTs from all across the world. PTs come. As long as they can pass the national PT exam, they're coming. Well, I would love for us as PTAs to be able to be exported. I think, can you imagine 10 years from now, a class graduates and 2 of the kids from that class are going to Australia to work in Australia? Would that be exciting? I think
that would be, yeah.
But so that's kind of where I'm at on my mission.
So it sounds like you have a grassroots effort starting here. You're reaching out, you're making connections, you're trying to get people on board with what's happening in your mind, and that's amazing.
Yeah, it's daunting. It's a daunting task, and I don't even know what the end results will be. I really don't. I mean, I hear people. I've had people ask me, says, "Well, Jeremy, you can't expect other countries to do what the United States is doing." And I'm like, well, I don't know if that's true. I mean, I think that there's a lot of educational programs across the world that are based off of the 12-year system. I mean, so America's gone all across the world, and some educational systems that they're using in other parts of the world, they started right here. They started right here. So I just imagine that, someplace like Australia or even Canada, they come up and I think Canada actually has a program, but they don't have a national exam and they don't have a licensure for the PTA.
Okay.
As far as right now. But I just feel like, this is a worthwhile endeavor. I'm actually coming to the end of my career. I'm getting close. And as I'm getting closer, I'm looking at what do I want people to remember, as I get closer to retirement. Well, I'd like to say that I was one of those champions for the PTA being recognized not only nationally, but internationally.
I think it's going to happen, Jeremy.
I mean, if one country said, you know what, a PTA assistant will help us deliver physical therapy economically and without sacrificing care. If one country did it, oh my goodness, I'd be like, woo.
Yeah, that would be cool. Yeah. Well, I'm sure that we're going to have a lot more people jump on now and try to help with this grassroots effort.
Yes. I mean, I would love to have people. And so like I said, I had people who were wanting to come to Dubai, and this Indaba session, it wasn't approved until it was probably 90 days out. I mean, it was kind of a scramble. Yeah. So I had to kind of get my travel arrangements and all that kind of stuff. And it was, the way the WCPT works is that when you go to conference there, they have different tiers of payment. So if you are from a rich nation, i.e. us, the United States, then you pay the most. And then if you're from a really poor nation, you pay the least. And I get the fairness of it because of the fact that some of these poor nations, they wouldn't be able to send delegates to this. And we want, from a world perspective, I want to hear, what's the guy over here doing with $2 that I'm paying $500 for? How are we rehabbing these people with less money?
What a perspective, right?
We got to figure it out. And so I got to attend many conferences and listen to some of them. The poster presentations are beautiful. They're wonderful. The thing about it is they're all in English. How about that?
Oh, really?
That
was something I was curious about, was how communication works and how do you know what you're hearing? And
right. So the official language is English. So that works out. That works out in our favor. Now, where it doesn't work out in our favor is that if in certain countries, if you don't speak the language, it's going to be real difficult for you to get a job working there. But so my next mission is to do a focus symposium, which that's the 2-hour program, and I'm going to try to recruit some folks because they like to have 3 or 4 speakers to go, and I'm going to put it on. It'll be something sort of like the physical therapist assistant for international purposes or something. Something that would get more people to come see it other than PTAs. Yeah. And
this is really exciting.
Right? Maybe physical therapist assistants. Is it right for your country? Or could your country use that? I don't know. But that's in Tokyo, Japan in 2025. And it'll probably be around May. So kind of start saving your money now.
Yeah, that's incredible. I can't even imagine. And I think that what's so exciting about it is this just kind of started as a spark, and now it's kind of like starting to flame a little bit here. And I'm really excited to hear where this goes. So like the Indaba, am I saying it right? Indaba session?
Yes.
So that's kind of equivalent to like maybe like a platform presentation or like
I think it's
a shorter version.
very short. You got to make your point, and then you got to be ready to answer the questions.
Okay, yeah. And then the symposium is more what we're used to at a CSM when you go in and you sit down for an hour and 50 minutes
Yes.
Yeah, okay.
Now, but there are different types of symposiums, and one of the ones I really liked was it was more discussion. So in other words, it was more that they could ask more questions. So in other words, you present 30 minutes, just boom, 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 knock it out, and then the group can ask a lot of questions. So when you do a focus symposium, there's different types of those. So I think that's kind of an important difference to make sure everybody understands. Because I really want it to be an open dialogue. I want people to ask lots of questions.
Of course, yeah.
I would do that. What's the point in doing that? Why you want us to make a whole nother profession? I mean, all kinds of good questions.
Yeah.
But I just really believe that there are countries out there that could utilize it.
Yeah, yeah. And you think of the beginning of a PTA profession for other countries, it would have the same growth struggles as what we have for over 50 years, like, I mean, I know I guess we're over 50 years now, a little bit over like 54 years, I guess.
Yeah.
However, we're still growing. We're still figuring things out. There's still changes to the PTA profession. We just went from a caucus to a council in APTA. And, there's still things that happen with regulation and how we're paid and reimbursed. So we're still growing and figuring out who we are as a profession as well. So you can imagine that another country bringing that in would have all those same struggles as well and growth opportunities.
Yeah, I think that evolution. We're evolving, and we've come a long ways from 1969. I mean, we've moved along, and we've shown our worth and shown our value. And the neat thing about it is that one of the things that I don't think we put enough emphasis on is that not only are we side by side with the PT in the treatment realm, we're side by side on the regulation, on meeting with our Capitol Hill Day. We're standing shoulder to shoulder. We're calling up our senators. We're doing grassroots campaigns to get direct access. Mississippi is we're one of the last three that does not have full direct access, right? And so Medicare Part B, I don't think they're going to move the needle on direct access until all the states have direct access.
Until everyone's on board.
So really, it matters not to a state that does. For Mississippi, it doesn't matter a whole lot because we don't have a lot of cash paying customers. Let's just say now California, in Florida, New York, Wazoo, that's fine. But what I think is that we're one of the 3 states that left that does not have complete direct access. So, me personally, because the PTs want it, I'm fighting with them. I'm right there with them. I'm making my call. And so that's the one thing that I think that gets left out of the equation, that there are so many PTAs. Sean Bagby, dang, that guy, what he's done with TRICARE and being a business owner and pushing forward to get TRICARE to pay for PTAs. That's a no-brainer in my opinion, but that's a lot of work behind the scenes. And I think that's where PTAs, we're recognized as treaters. We're recognized as clinicians in getting people better and applying the interventions that the PTs are wanting. We know, everybody knows that. But what they don't know is the advocacy that goes on with PTA in every state. I could make tons of PTA that have just blown my mind. Brad Thuringer, Shoes for Kids. Everywhere it goes, Brad's got shoes out there, and these 10,000 shoes, and going to these schools, and I mean, it's amazing,
Yeah.
So I just love stuff like that.
Yeah, there's lots of PTAs doing really amazing things out there, and I'm hoping that I can bring some of these voices forward. But just to touch base on your advocacy, I mean, I was just at Advocacy Day for Ohio back in April, and here I am, the only no, I think there might have been one other PTA that was actually in PT school at the time, but I'm in a group of about 6 or 7 people, and we're meeting with the aides for our state representatives and our state senators, and they don't know who in the room is a physical therapist, is a physical therapist assistant, or a student until we introduce ourselves and tell them. But
Exactly.
us as a collective, we're the experts on our field as a collective.
Yeah.
And I was able to speak to all things that PTs do as well as the PTAs do, just as well as anybody else in that group. We were all there as a united front, a joint effort to work on what it's called House Bill 141 here in Ohio, and that's the Fair Copay Act. And that's so important. If we can bring copays down to that of a general practitioner instead of a specialist, that's going to change things for our patients that can't either afford to come or turn to something different, opioids or something else instead that could potentially be harmful to them, but saves them money. If we can just bring that copay down. And this is just an example to just back up what you're saying, that, if we all come as a united front, our senators and representatives can't hand pick out who's a PT and who's a PTA. They just know that we're all there with one voice.
What they're concerned about is that you're a constituent. That's the big. And how many Jeremy Fosters and Katie Suttons are there out there? Do you see every state? We know that these council reps, the caucus reps, they're going to the state days. They're making these differences, and they're talking from a different viewpoint than some of the PTs don't have that same viewpoint that we have. So that's just one area, and this is why I'm so happy about what you're doing. And I think that we need more people out there just spreading this word, because there's some really awesome things that are going on, and we need everybody to be aware of those things, And I think one thing that I hear about from non-members is, I'm not going to be a member until APTA does this. And that really frustrates me, because I tell people all the time, I'm APTA. I am. So when you say we're not doing something, why don't you join? Help me out here. Help me out.
Yeah.
Because the waters are tough. We need more. And the APTA, like any organization, the larger that we become, the more PTAs that become members, the larger our voice, the more the APTA says, wait a minute, look at our membership. I mean, if we only had half the PTAs practicing in America as members, we'd be the loudest voice at the APTA. We'd have 30 delegates.
Isn't that incredible to think about?
Membership is such a hard sell, and I'm constantly talking to. That's another thing I do. I try to go to each school. We have 7. Well, we have 1 developing program. We have 6 active programs. We have 1 that's going online pretty soon, and that's 7. So I've been to each one of those schools in person to talk about, please don't let your membership, because they're members now. And if you look at the graph, so students come in and the membership goes like this, and they graduate, goes like this. It's so frustrating. And I get the question I get all the time is, why would I pay those dues? Why would I pay those dues? I get a couple of magazines, the discounts I get aren't worth the fees I pay. And I explain to them all the time, it's the stuff that you can't put your hands on.
It's intangible items.
Yeah. That's right. You can't put your hands on advocacy. And that's what's happening every day. And such a small number of our profession make the biggest differences and changes in our profession. It's not the large numbers. It's the small numbers. It's the small places that are making the big differences. And this is where, one person can make a big change. I'm hopeful that at some point in time, one of these countries will say, you know what, we could use PTAs, and next thing you know, we're over there.
Yeah. Yeah. However, you might have to go and start it. They might hire you. So
gosh, I'd hate to have to go travel somewhere.
yeah. Yeah, of course. No, but I agree with you. I think that number one, PTAs, we aren't out there enough telling people about all the amazing, unique skill sets that we have in general in physical therapy. You and I talked about earlier that we aren't doing a great job of representing ourselves and putting ourselves out there. And if we don't have that united front and that voice, we got to be careful. We don't want to get steamrolled.
That's right. We need professional marketers. That's what we need.
Yes. Yeah, absolutely. Okay. So what's next? So you are going to go back to WCPT, obviously, right?
Yeah. So yes. So the next, I'll tell you what's going on. So July, obviously, we'll be in Washington. We'll be attending the House of Delegates, and we'll find out what the PTA Council, how we're going to evolve with that. Also, we have Capitol Hill Day, which is Tuesday at the House. So that's all happening next month. In November, I think it's November, I'll be in Austin, Texas at the private practice section as a member of the PT PAC. So my red jacket.
Got the red jacket on, yeah.
Nice thing about that is you don't have to pack as many suits.
Yeah.
That's the nice thing. So then after that, we'll have CSM coming up in February, and I believe that's in Boston. So that's going to be exciting.
I'm already cold, but that's okay.
But I'll tell you what, we were there. I think it was 2017, and I'm going to tell you what, it was actually hot. It was in May, and I'm not sure if that was House of Delegates. That wasn't CSM, I think.
Okay.
Anyway, we had I had a lobster roll, and I had some chata. And
sounds delicious.
That's the future. That's what's coming up, and then of course. During that period of time, I'm going to be working with as many people who want to help. By the way, I'm throwing that out there for anybody, any PTAs, PTs out there that want to help with a definition of what the physical therapist assistant is. And keep in mind that it has to be encompassing of education, licensure, regulation, continuing competence, all in a nice little packaged definition. And
perfect. Hey, this is our chance to be innovative.
Yes. Work it to death. Words. I mean, but we make sure that people that aren't from America would understand what the difference between what a physical therapist assistant is versus an aide, tech, or helper. So that's kind of the future.
Awesome.
Tokyo is 2025. So
wonderful. Yeah, and we'll have to have more conversations about that coming up.
Yes.
Yeah. Okay. Amazing. So, I mean, you and I, we could talk for a lot longer, but I feel like we should save some of this for later, though. But
yes.
Okay. So, why don't you go ahead and tell us what your plus point is? Because I know that you have some really cool things to tell us. And so, our plus point is like some closing words of advice, our big ideas or thoughts, anything you can kind of wrap us up with. What do you got for us?
All right. So 3 things. My first thing is my advice, and this is my advice I got from my educator, Ken Freeman. Continue to learn. Find your niche in therapy and learn everything you can about it. Physical therapy is so big from head to toe. There are so many little, from wound care to balance and neurology and just strength and conditioning. We could go on and on, but find out what works for you and just be the best at it. And look, I'm all about the pathways, the clinical pathways the APTA is offering, but any way you can, get that continuing education and don't just take the bare minimum. I know some states require 10. We require 30 per 2 years, so it's like 15 per year or whatever. But don't pass that. Find your
Shoot
niche.
for the stars. Yeah.
That's right. The second thing is my encouragement is you just keep showing up and keep your head held high. Always know that you have something to offer, and be in a room full of, the people in the room should be smarter than you. You try to absorb and soak it up. And remember when school you wanted to be a sponge and soak up all that information? Stay that sponge. Always soak it up so that later on you can squeeze yourself a little bit and give that education to somebody else. The third thing I want to do is a call to action. This is the last one, is that number one, join the APTA. We need you. We want you. You have stuff that this place, we got to have you, because the PTAs, we need a stronger voice. And so that's what I would leave you with, is that, come join us. There's a movement going on. Great things are happening.
Yep.
And don't let naysayers hold you back. I mean, shoot, we're moving forward. We're going.
Oh yeah, we're moving and shaking.
That's right, moving and shaking.
Well, I don't know about everybody else, but I learned some new things today. The Andabi session, I have to admit, I had to Google it ahead of time because I read it and I had no idea what that was. So I'm happy that you brought it back up, because I'm not sure that everybody would know what that is. But yeah, that was something that I had to Google. And the red coats, although I now know what it is, and I have known what it is for quite some time, but that's kind of like my beginning story of how I decided to step up and get involved a little bit more, was because I went to CSM. This was years ago, and I was overwhelmed and I didn't know what was happening, and I was really confused, and I couldn't believe that there's this huge conference that had all of these amazing minds together and all these different sections represented, and I felt like I had missed out on so much for so long. And then, just to confuse things even more, I saw these people walking around in a red coat, and I'm like, what is happening? So that's kind of like my beginning story into getting involved, because I wanted to know more. And I have to admit, the redcoats did kind of like push me a little bit to figure things out. And it wasn't just that, but I went back home and I started researching, and I looked up who I needed to talk to and who was responsible in our state for PTAs. And I just started looking up names, and I started showing up. Like you said, I showed up, and I didn't actually have anything to do right away. But I showed up and I started asking questions, and then it just kind of opened up doors, and one thing led to the next. And as an educator, I never wanted to be inept to answer questions to students. Maybe I'm not the smartest in every facet of physical therapy, but I wanted to make sure that I could answer those basic questions for them. And to me, it was knowing those people who were in charge of specific areas and who our PTA council representatives were, caucus at the time. And, that was important to me. And so that kind of sparked a journey for me. And what I'm hearing from you is that somebody said, well, I don't think this can work. And you found this problem, and now it sparked something for you to solve. So you're now on a journey of solving this new thing for physical therapist assistants. And I think that we're going to see some big things.
One thing you mentioned about the APTA is an APTA leader once told me that the APTA can be as little as just paying your dues and you're supporting the cause. That's great. But the APTA can be as big as you want it to be. There's so many volunteer things to do. I encourage people, you want to get involved. There's a whole bunch of stuff on the website where you can volunteer, name in there. And sometimes it's for one little project. I wanted to mention this. If you don't go to the Academy of Acute Care website, there is a document on there that I was the chair. They pointed to me and they said, hey, we want this document to look like, they've got one it's called Core Competencies for the Physical Therapist Assistant, and kind of what they should know when they get out of school. Because they made one physical therapist, so they wanted one for the physical therapist assistant. So I got to work with with some PTs and PTAs, and we put forth this document. It's on there. And so what I'm saying is there's opportunity for you in the APTA. It's what you want to make of it. But if you want to change
absolutely,
you got to get in and make it from the inside out.
Absolutely. And I couldn't have said it better myself. So that was the perfect plus point.
Thank you so much for having me.
Yes, absolutely. Thank you so much for coming, Jeremy.
Thank you so much. Let me know, and I'd love to do this again later on down the road.
Yeah, absolutely. Well, I mean, we're going to have to ramp up before 2025, right? Yeah. You said Tokyo, right?
Yes. I want to send out we need to put it on the calendar because I want to send out an invite to everybody. Say maybe in December. No, November, December. Send out an invite to everybody saying it'd be great for you to show up.
Absolutely. Hey, people, put it on your calendar. All right. Well, Jeremy, thank you so. Oh,
we'll get
go ahead.
We'll get 8 people in a room over there. It'll cost you $20 a night to stay, and we'll just get 100 PTAs over there. Would be great.
He even has a plan. He's got it all figured out. Oh, I love it, Jeremy. You got your plan. Okay. Well, thank you so much for coming and telling us all about this. I can't wait to hear more. We'll have you back. We're going to ramp up and get you ready to go for Tokyo in 2025. So, all right, everyone, you've heard it from Jeremy himself. All right, thanks for listening. The PTA Plus podcast is hosted and produced by Katie Sutton in collaboration with PT Podcast host and CEO Jimmy McKay. Thank you for listening to another episode of the PTA Plus podcast, where the conversation is for PTAs by PTAs. This show is for educational purposes only and not intended for clinical decision making. While care is taken to ensure accuracy, factual errors can be present. Become part of the PTA Plus podcast family by liking, sharing, and subscribing on iTunes, Spotify, and anywhere you can listen to podcasts.